I have patient who comes in, I say that I have a toe pain or I just fell down. But when I come in, I say, I'm very hungry. Can you give me some food first?
Welcome to the third episode of Hidden Heroes. In this episode, we will feature a healthcare worker. Hi, today we have our healthcare worker here with us. Maybe you can introduce yourself.
My name is Kenny here. I work in the healthcare sector as a nurse for more than a decade. And today I'm going to share with you regarding what are the nurses' job and what is our what do we do daily and what are the challenges that we are facing during the COVID time, and maybe it would help you have a rough idea of what we are doing. Also to clarify some misconceptions of healthcare sectors, such as example, healthcare sector is a dirty job and it's a very difficult job because they are handling old people.
How long have you been working at this job?
Okay, I've been working for more than a decade, so more than 10 years. As a nursing student, which is that will be 2005. So 2005 until now, it's more than a decade already. We have pre-hospital setting and hospital setting. Hospital setting, A&E, inpatient, outpatient, rehab. And for pre-hospital settings, is mostly paramedics. Paramedics, I've been working there for 7 years or so. So 7 years as a paramedic, and 6 years, 7 years, near to 7 years for in A&E sectors. So accident and emergency department, it's more towards getting the treatment and stabilize the patient's condition, and we segregate or we put patient in the respective disciplines. Disciplines as in, like, we have respi. Respi means lung specialist, cardio means heart specialist, and neuro means brain specialist, and ortho means bone specialist. As for A&E, we do not select, it's not like specialist clinic, we don't perform like specialist ward itself, because A&E comes in with various of patients.
Okay, so for the next question, can you describe your day-to-day job? Like, what do you do usually?
Okay, day-to-day job is the patient does come into A&E. So any kind of patient, irregardless, psychological, or is it like physically, is it like trauma? We call it trauma. Trauma means the accident, people who met accident with a car, people who fell down at home, assault case whereby people fight and then they were being punched or they are being assaulted. And we also have, like what I say, medical cases like heart cases, lung cases, and brain seizure cases, etc. So we do prioritize and we do stabilize patient condition first. So in the A&E, we need to determine which or what are the most important things we need to cater or we need to do at the very point of time in order to save the life or in order to stabilize patient's condition. We don't do anything that is unnecessary at the very point of time. We just do that whatever we can make sure that patient is stable or safe, and we refer to the specialist. I have patient who comes in, I say that I have a toe pain or I just fell down. But when I come in, I say, I'm very hungry. Can you give me some food first? So it's the irony, you know. So in A&E, a lot of time, we usually by default, we don't let patient eat first because we don't know what procedure they will need to go through. Let's say patient come in for giddiness, or let's say patient come in for a headache. They need to go through a CT scan first to see whether they have any brain bleed, which might require them to be fasted. Fasted means that they cannot eat anything or drink anything for several hours before the surgery or procedure is done.
What makes you want to be a part of this industry, like the healthcare industry?
Okay, so I like critical care. As a nurse itself, I like medical. But the problem is that medical, there are pre-hospital and hospital settings. So pre-hospital setting, I've already been there, been through the paramedic training for 7 years. When I'm in the pre-hospital setting, I just want to have a taste of what is it like to be a hospital settings. Because pre-hospital settings, as a paramedic, everything is not under your control. You are only limited to a certain resources. You have the basic ones like the oxygen, the defib pad to shock the patient. But say you want the CT scan to be done, you need X-ray. You cannot bring along your X-ray, right? So this is the limitation.
So is it right to say that you like working in this kind of setting and that's why you joined this line of work?
Okay, one thing is adrenaline rush and make you feel great when you see the patient from unconscious or not responding patient to become a responding patient. where let's say when you have a pediatric, that means like for children, patient or mother who came in crying, they say, my children is sick, all this thing. Then you explain to them and you give them the treatment. The child is better. You see the relief with the parents and you see the relief with the family members that you provide the care with. That makes you have the pleasure of working. Yeah.
So the next question is, how has the COVID-19 pandemic affected your work?
COVID-19 cases, they really affected the way we work. Last time when we admit patients to the different disciplines or the inpatient wards, there are lesser steps where we just contact the specialist or push the patient to the ward. This is a more straightforward. But then when you're having pandemic, you have to scan the patient very, very thoroughly. So it's an extra step because you have to make sure that the patient doesn't have any signs and symptoms of we call ARI symptoms. That means like acute respiratory infection symptom, whereby they have a cough, running nose or sore throat. But it depends on the medical officer. Medical officer means the doctor's discretion whether the patient should or should not be placed under an isolation area. So if let's say patient is having some such symptom and we cannot take for granted or we cannot take chances, we still need to do the swab test and the ART test and the PCR test for the patient before they are admitted. But after they are being done, the swab test, if let's say they are really having a clear-cut symptom of ARI symptom, so we still have to put patient in the isolation area first so that it will not contaminate all other patients. So space is a constraint. Space is really a constraint. For this kind of pandemic, there's a certain surface area or a certain distance you have to keep the patient away, and then you have to isolate the whole ward or the whole level in order to contain the viruses. So that's a consideration. And gowning on with the full PPE, with a gown and all these things, it really affect our work as when we want to do IV cannulation, we want to put needle with all the goggle and all the face shield and then all the masks and the gloves. It's giving us a lot of challenge. You tend to sweat inside. So when you sweat inside, your hand will be slippery. When you do the cannulation, adds on to the challenges. That's the problem with all the things that COVID-19 is affecting us. So it's making us work harder, but it's another experiences whereby we tend to adapt. Yes, we can adapt to when difficult times appears or happens. Yeah.
So now we'll move on to the would you rather section. So what this section does is we'll give you two items to compare and you'll choose which would you rather do and you will explain why. Would you rather be a paramedic or a normal hospital staff?
Like what I say, pre-hospital and hospital settings do have their own challenges. For me, because I started off as a paramedic, so paramedic is when you want more experiences and you want more exposure. Paramedic can give you a lot of exposure because you go to the first-hand scene. Police and you and even a firefighter work together. I have one case whereby there's a collapse case in the Rifle Range Road at the Bukit Timah Nature Reserve, which is very deep inside the forest. That is a very memorable one because you have to rush in and carry all your medical equipment, all the defibrillator, etc. And you have to rush in 45 minutes running to the area and then rescue the person. So stamina is another consideration. Hospital settings is A&E wise, you work with doctors very closely. Paramedic wise is you are alone. You don't have a doctor to guide you. So responsibility and the stress is a lot higher, but the satisfaction is a lot more higher. So that's what I like about paramedic. So in the end of the day, you say paramedic or I would still say paramedic.
Okay, our next question is, would you rather have people help for healthcare workers or have people not avoid you on public transport?
Okay, for this question wise, healthcare workers have to be respected. So unlike Western countries, nurses are very, very, very well respected. Singapore-wise, there's still more. Yes, there's still a stigma whereby nurses they do dirty job. They clean patients, feces, or they need to bathe patients. But besides that, actually nurses we do a lot of collaboration. We do rehab care arrangement. We take bloods for patient and we have to monitor patient closely because the nurses are the hands of the doctors. So without the nurses, the doctors are handicapped. No? So healthcare workers needs to be respected. And let's say during this pandemic time, we actually are very, very careful the hygiene, our own hygiene, and the PPE that we are wearing, and how we juggle, and then all the SOPs to follow. So the should not avoid should be the better ones as a respect for their job. That except for healthcare workers, somehow or other, different healthcare workers have different point of view. So some healthcare worker might think that are you trying to be discriminating or something like that. I have some articles whereby my friends say we shouldn't say that nurses are heroes because we are still doing our job. We are just as normal as you. It's just that the determination of carry on with the job is still there. Yeah. So that's the thing. Okay. So next one.
Next, would you rather prefer shift work or office hours like 9 to 5 job?
For the shift work itself, for me, I'm already adapt to the shift work itself because I do my own arrangement and my time schedule. But if let's say you want to compare, different people have different perspective. They have their own life, For me, we don't have a family, so it's easier for us to adapt to rotational shift, whereby I do my own arrangement, my recreational. I can do the gym at my own convenient time. I can go when I go out with my friends, etc. But then for people who have family like child and kids, they have to take care. So they would rather prefer office hour because at least they can put their family member or their child daycare center or etc. So that when they come back, they can continue the care and the family time together. I still prefer rotational shift.
So like it's just you're saying that if you have a family in the future, you might prefer the 9 to 5 job depending on your lifestyle. So it's different for everyone.
Correct.
So now we'll be moving on to our conclusion questions. And what are some misconceptions of your job?
Okay, the misconceptions of the job itself, like what I said earlier, we only do cleaning for patient or bathing for patient. Actually, we do a lot like medication, ensure them they are taking the correct medication, the correct amount at the very time. Then we have to arrange for patient rehab. Let's say they are for stroke patient, they are for rehab. So we have to arrange the time whereby the doctors can see them and can assess them, and then so that patient can get the appropriate rehab. Nursing is about more time arrangement and time scheduling. So this is the misconception. Another thing about A&E is that because it's about teamwork, so how to make nursing effective and more holistic. Yes. So holistic care requires a lot of nursing teamwork. So without teamwork, it's like a puzzle. You cannot cover each and every piece if you are alone. So if you have all the pieces together or all the healthcare workers together, it puzzles up to be a better picture, better coverage for the patient.
Okay, so lastly, what do you want the viewers to know about your job?
For us, whenever you see us outside, just be neutral. Heroes, not to the extent, but maybe just give a basic respect for each and every nurses and healthcare workers because we are also doing our job. We must respect every individual. That's the most important actually.
Thank you for watching this episode of Hidden Heroes. Don't forget to like, share and subscribe. Do DM us if you have any inquiries, and in the meantime, stay safe and mask up. Thank you.
Let's say you bring a patient and suddenly you're having some foul luck whereby your ambulance break down, right? I do have these kind of experiences. So at the very point of time, you have to think of ways to counter the problem, like call your fellow paramedics to come down with another ambulance to counter or to bring the patient to the hospital. So at the very point of time, you have to stabilize and you have to look after the patient for a while before your colleagues takes the patient to the hospital.